Happy day. This is Positively D discussion. You have to remember that HIV still exists. You have to get tested. You have to use protection. Because if you have contracted HIV, you could get on medication and you could live a better, healthier life. I am going to bring on two beautiful, strong women from PWN-USA, Nana and Vanita. And I'm going to bring them on right now. Hi, Nana. Hi, Vanita.
Hey,
Hey,
thank you so much for having us here today. Good to see you.
Welcome. Glad to have you. It's been a long time. I don't think I've ever had you guys on. Not
Too
like
long.
this, barred
no.
from years ago, but I've never had you two on that I could remember. So yeah, this is a joy.
It's good to
Um,
be here.
you guys introduce yourselves, and then we'll get into how PWN. Well, introduce yourselves, Nana and Vanita, and then we'll get into how PWN got started and what they do, and we'll start from there. So Nana, go ahead and introduce yourself and your position at PWN.
Okay, cool. Hey, y'all. I'm Nana Khanna, she or they pronouns. I'm one of the two co-directors at Positive Women's Network, and I live on occupied Ohlone land in Oakland, California. And my twin star, Benita Ray.
Hey,
Twins.
folks. D. Davina is good to see you, sweetie.
Good
Vanita
to
Ray, she, her pronouns. I live in Houston, and all of this land is taken from other folks. So I'm just gonna say thieves. No, but I'm the other co-executive director with Positive Women's Network, a woman living with HIV, Houston, Texas, and just good to be here.
Yeah, glad to have both of you. So let's talk about PWN, Positive Women's Network. If you've never heard of it, you guys, you can go to pwnusa.org, pwn/usa.org, and you can see what PWN is doing in the US here. Um, Talk a little bit about when PWN started and then what PWN does for women.
Yeah, I could start us off. And,
Mhm.
you know, PWN, I come to this work as a person living with HIV. I was diagnosed in 2002. And like many folks living with HIV, I didn't really know how to deal with my diagnosis when I first was diagnosed. And so I was kind of living my life, doing other kinds of organizing and activism and advocacy work in other spaces, and not really dealing with my own HIV diagnosis, and even not, getting my blood work done and things like that, because I did not want to get cut from health insurance programs, because at that time we didn't have the Affordable Care Act, and you could be denied health care and health insurance for having a pre-existing condition. So I was afraid to even get my viral load checked, my CD4 count checked, and all that. Anyway, when I finally did start to get into care, I had some bad experiences with providers. I faced some like misogyny inside of healthcare settings and things like that. And I was really looking for some more support from other women living with HIV. And I was very lucky to find it. But it took a while to find that. It took a few years to find support and to find other women living with HIV who had been dealing with similar things and who could understand things like my questions around taking medication and what it would mean for my reproductive future or for my sex life or things like that. And so I did eventually get connected to an amazing community of inspiring folks all around the country. Over the years, I was privileged to meet people like Vanessa Johnson and Rebecca Dennison and Dawn Averett and Pat Knowles and so many women living with HIV, Linda Scruggs, who had founded organizations, started programs, were doing work in the community. I got connected to people like Wahida Shabazz in Philly. And as we were like connecting with each other, and I was learning from many of these women who had been in the field and in the movement for a long time, we started to talk about the fact that we didn't really have any type of organized voice for women and trans folks living with HIV at the national level in terms of policies. And so in policy conversations, when decisions were being made about things, a lot of times our needs were not reflected there in a collective way. And when women living with HIV were being invited to perhaps provide input on processes, it was like one-off, kind of like tokenistic representation. It wasn't organized representation, or there was no plan for folks to kind of connect and coordinate with each other. And a lot of times, it was middle-class white women who were representing women living with HIV in those spaces. And that did not reflect the majority of people who are impacted in this country and the different types of harm that folks are experiencing, especially Black and brown, queer and trans folks living with HIV, low-income folks living with HIV, people who are dealing with incarceration, substance use, mental health issues, lots of different forms of systematic oppression that change the way we need to be engaged around service delivery or research or things like that. A bunch of us came together in 2008 to kind of envision what it would look like to create a collective container to advocate with our communities and bring the power of our communities, because folks were already doing the work, right? So this was like Pat Kelly, who had already been organizing in South Carolina, and some of the other people I mentioned, Wahida, Linda, Vanessa, Pat Miglior, who was one of the co-founders of Babes Network in Seattle. So folks who had been in the work, providing support groups and running organizations and running programs. We all came together for a few days to kind of vision what we could do together. And from there, we birthed the beginning of Positive Women's Network. It was in June 2008 at a meeting in San Francisco. And we basically spent those 3 to 4 days really thinking through what was going on for our communities. It was a very diverse group of folks. From our founding, we had people who were of trans experience and gender nonconforming as part of our founding membership. We had our youngest founding member was 21 years old. Our oldest was 72 years old at that time. We had folks from the South. We had people like Lisa Tiger, who's from the Native American community and has been working in that space. And so it was a really diverse group of folks who came together and basically said, we're going to try to do something differently here. And that's how PWN first was formed.
Yeah, thank you. I like how you said PWN was birth, but not only that, how you gave flowers to all the other women in the field of HIV who were doing the work before you. Um, I think a lot of women, we always feel like we're the only ones until we find so many other women who live with HIV. I always say, what about the other women, the ones that no one knows about? And so when you start connecting with all these women, it changes your whole life. And you're like, I know I can do this. It makes you feel so good about what they're doing. And you want to put your whole body into it. And that's what you've done. That's what all the other women have done. And that's what PWN has done as a whole. I've seen that since I started advocating in, goodness, 7 years ago, almost 7 years ago, someone reached out to me. And you guys have been doing the work and hitting the ground ever since. Talk about the changes that you guys see coming, or what you're seeing before you that you're planning on doing now.
So I think it's interesting to really connect where Nana talks about 2008, and that starting, after that we got a national HIV/AIDS strategy, how things have evolved, in terms of involvement, and just the way the political landscape has changed. And so it was always about meaningful involvement of women living with HIV in decisions that impact us. It was always about how do we get our collective voice heard? How do we raise the leadership and visibility of the women who want to be visible, but we're always keeping in mind the women who are not there, and the folks
Right.
that the needs. So over time that has shifted, because when they started, there was no national HIV/AIDS strategy. There was no, there were a lot of things you had, in the beginning of the epidemic, this kind of grassroots kind of thing. And we've seen the rise in HIV Inc. And so advocacy and power building has changed. So some of the ways that we are responding to the change, it could, whoever politically is changing, but just is how do we, our theory of change is about building power in our community. So there's a number of ways we do that, whether it's building the leadership and voices and preparing women and folks of trans experience to be at those tables. And we're demanding the right to not have decisions made in our absence. That could be about changing the narrative about the way that we're talked about, that we're telling the stories like you're doing today, and running the story and changing the narratives about who we are, what we want, and making sure folks aren't speaking for us. It could be one of the big ways that we do the work is in policy advocacy, whether it's at the state level, locally, where our women and folks really live, involved with whether Ryan-wide planning councils, planning bodies, at their healthcare places, wherever that may be. Statewide, we're seeing the need for a lot of state legislative advocacy and how our folks work. We know that the epidemic is centered in the South. So, really doing some strong organizing there, which we've been doing more because that's really where the majority of our members live. And then there's a federal level of advocacy that we've been doing not only as an organization, but also collectively with other folks, networks or other coalition tables, networks of other people living with HIV collectively, and the federal landscape. One of the big things that we did last year was, help develop and spearhead the first policy agenda written by people living with HIV, the first time ever to move our agenda at the federal level. And then some of the other work that we're doing that building power is in getting out the vote, nonpartisan electoral organizing. Not only do we want to hold elected officials accountable when they're in office to meet our needs, but really advocacy begins at the ballot box.
Right.
They say our communities are hard to reach. They're really not. If you live there and you don't just go there once every 2 or 4 years, we are there every day. So, how are we getting out and talking and building relationships with our folks who then know and trust us and are getting more engaged in whether just registering to vote, speaking up, making sure that polling locations are in places that people can go to. So there's a wide range of ways we're thinking about that we work to build power, and whether at the local level, the federal level, and in specific strategies around policy, strategic communications, and leadership development.
I think, what really occurs to me is just the ways in which women living with HIV and trans folks living with HIV have always been on the front line, pushing the movement to be more radical, more intersectional, more inclusive, creating and pioneering solutions, from Lauren Jones, one of our founding members, who unfortunately passed away last year, who has been, just a tremendous leader on economic justice and housing issues and in incarceration spaces, and making sure that people living with HIV are being treated properly and have re-entry and release protocols, and working to decarcerate and abolish the prison industrial complex. From folks like Lauren to Juanita Williams, another of our founding members, who was one of the founders also of the Sister Song Reproductive Justice Women of Color Collective, that created a whole framework for reproductive justice, grounded in Black women's vision of future and family creation and safety and everything that it takes to create and sustain families. These are Black women, trans women, women of color have always led the way in HIV, and we continue to do that. And so when you talk about what's in the future, it is women who are driving, women living with HIV and trans folks living with HIV who are really driving a lot of these organizations and who have built our movement to what it is, but not only built the HIV movement, have also created housing justice, racial justice, reproductive justice spaces, and so many solutions, because we're really clear that none of us are just about one issue. HIV is not actually the problem. HIV is a symptom of many
Yes.
different systems that are
Right.
spotlight on all these ways that racism and transphobia and policing and the safety net being fractured and like unbridled capitalism, like all of this stuff is really harming and impacting our communities. And so when we look to the future in terms of the theory of change, it's really how do we build power for, if we can build power for Black women living with HIV and Black trans folks living with HIV, then we automatically lift everybody up. That's our theory of change at its core. And so that's why we work on political power, power at the ballot box, making sure that folks are in spaces where they can lead, and that our issues and our movements are responsive to all of our needs as holistic people.
Thank you. Thank you, both of you, for explaining and letting people know what PWN does and what they're about. The question that I have is, in all the work that you guys are doing, have you seen any negative pushback, as far as legislator and policy? And if you have, what is that?
Sharing power all the time.
Yeah.
So we are clear that, as Nana said, HIV isn't the problem. It is a symptom of the problem. Capitalism, all of these other kinds of things that are at the root of this. So, there's always pushback to making space at the table, wanting to share power or give up power. I mean, we see what the fear of that has done in so many other ways. So I think there is pushback. We already know about the pushback,
Mm.
but we also see movement as well. That there might be. So I feel like we always have overt and covert kind of champions and support. And so there are some people we might not agree on everything, and there's pushback on something, but we might get support in some other on another issue. So I think there's always pushback to sharing power, and we know we live in a racist capitalist environment. So let me just not even just stop there. And when we're fighting for folks who have been historically oppressed and marginalized, and so that fight is real. Folks will say we got a Black president or a vice president. The struggle is real. Nothing changed for us in 2022 in the struggle and the fight for liberation for Black folks or for First Nation folks or anything else. So the pushback is real. Our country was built on white supremacy culture that we're really, most of the work we're about is about redistributing wealth and power. So the pushback is real all the time. It just means we just fight harder. We are more strategic. We are aligning where we can, and then we're being bold and going out on our own where we have to. So pushback is real. You just don't, we haven't overcome. I live in Texas. Our trans kids still, instead of, liberation, or instead of seeing more support, we're seeing less. We've seen reduction in what you can teaching history in a school. You can't even talk about anything that makes white folks comfortable. That is a pushback in a different way, but we are not stopping because of that. And that just tells you, to me, that we're being more effective than not when you see the fear, causing folks to really just do much more extreme measures.
The fight never stops, right? We always say there's a lot of work to be done. Even though it looks like the work is getting done, there's still always going to be a lot of work that needs to be done. Go ahead, Nana.
I think, we're in this era where we're kind of in this last gasp of white supremacy and the cis heteropatriarchy. And the folks who are white cis men are basically doing anything that they can right now to hold on to power. And that's not just outside of our movement. Let's be clear. Like, we're not only talking about legislators and policymakers, because that happens within our own movement too. But this is why we're seeing things like this massive spate of anti-trans legislation at the state level, increased visibility when there's not always policies and power, sometimes is dangerous and harmful for communities. It can, elevate danger. It's the same reason that when we work on HIV decriminalization issues, we don't always go to the media on this. The media is not always our friend. It's not necessarily friendly to us to have the public eye on these issues that we're trying to change. What we saw happen with the recent Supreme Court confirmation process, nomination process and confirmation process. And it is amazing to be recording this just the day after, Justice Jackson has been seated. That is, wow, what a moment we're in. But we also saw what it cost to get here, and what it cost to her, and what it cost to her family. And that is unacceptable. That's some of what we're in. And that's why PWN focuses on things like, that's why we run a policy fellowship program. That's why we work on building power for BIPOC advocates living with HIV to participate in the HIV decriminalization movement. That's why we run organizing programs like the Texas Strike Force to build power for our people on the ground. That's why we're doing voter engagement. It is nonpartisan, but it's on issues, right? That's why we passed ballot measures in Philly on housing, and in Denver on shelters last year. That's why we worked on questions about police accountability and racist policing practices in Philadelphia in 2020. That's why we worked to expand family medical leave in Colorado in 2020. That's why we fought the attempts to cut a few thousand people off the ADAP program in Texas. We are fighting reactive and proactive battles at the same time. And as we're doing that, we're building longer term power for our folks to engage in any struggle, because the struggles are so much bigger than anything we can imagine, especially in this moment. Look at this recent climate report. Like, we literally have not time. And we see how this is impacting our people, from the winter storms to the hurricanes to the tornadoes. Like, these issues are not disconnected from each other. Environmental issues are racial justice issues too. And so they necessarily impact our folks. And so building power requires kind of like understanding how these issues are interconnected, but really understanding them from an embodied perspective. And there's nobody who understands that better than people who are directly impacted. That's why we trust our members to lead the way. Our members are brilliant. They know exactly what is needed in terms of policy solutions, because they are living the problems of existing policies every single day. They already know the answers. If we could just get all of our people into power, we win.
Yes. We win. Of course we'll win. It's funny how nobody knows what so many strong advocates do in the background. Everything doesn't have to be up front and center. And you guys are doing a lot in the background, a lot that people don't even know about. I want to talk a little bit about this People HIV Plan. Talk a little bit about that. And I'm going to put the link up again. Talk about the People's HIV Plan.
So we're really proud of this plan. We've had a national HIV/AIDS strategy since 2010, but the national HIV/AIDS strategy has not always addressed the issues that are most important for people living with HIV. This is a federal plan that is designed to address the whole domestic epidemic in the United States, the domestic HIV epidemics. And that plan was first, created under President Obama in 2010. It was updated in 2015. And now we have a new version of this plan that just came out in December 2021 under the leadership of Director Harold Phillips at the Office of National AIDS Policy. And Director Harold Phillips is an incredible leader and comes to the work as a Black gay man openly living with HIV leading this White House level office on HIV policy, which is incredible. You know, it's such a win for the community to have his leadership there. And so what we see in this new plan is a more intersectional agenda that really does attend to some of the human rights and quality of life issues for people living with HIV. But basically, part of the way we got there is that all of the networks of people living with HIV under the banner of the U.S. People Living with HIV Caucus have been convening for about a year and a half to work together on moving a policy agenda for this country that is accountable to the 1.2 million people living with HIV in the United States. Because we know that what we need to be understood and seen in federal plans and in any policy solutions as more than our viral loads. We need more than like success for us cannot be measured by us being undetectable, right? Like that's not actually the measure of success. The success for us is like, are we well? Are we mentally well, emotionally well, physically well? Do we have a safe house to be in? Do we have food to eat, nutritious food to eat? Can we take care of our families? Well, the answer to those questions is increasingly no, because of some of the other factors that we talked about earlier, like, you know, capitalism and other things that are really impacting quality of life for people living with HIV. So this plan that the networks put out last year was really an effort to demand some solutions that look at creating a better human rights environment for people living with HIV, that attend to us as whole people aging with HIV, and things like that. And so that's really what the People's HIV Plan is. You cannot claim to have an effective response to the HIV epidemic in the US while we still have laws in more than 24 states that are criminalizing people based on HIV status. So, you know, these things just don't make sense. We cannot claim to have a response that is really working for people living with HIV when we have surveillance practices that are creating more risk of policing and harm, especially for Black and brown folks and immigrant folks living with HIV. So this is what, if you look at the People's HIV Plan, we are putting forth policy recommendations that say, here's what you need to do to create an affirming human rights environment for us. Here's what you need to do to improve the quality of our lives. Here's how we want that to be measured. And by the way, you can't do this without partnering with us. Stop seeing us as just like consumers or clients or objects to be managed and people whose viral loads need to be suppressed, like as if we're just like weapons moving around in society. We are whole people with dignity. We demand to be treated that way. We're still going to be here when the epidemic is, quote, over. And we will be parts of this community no matter what comes.
Demanding better. Okay, so I just want to get that out. It's called demanding. We are demanding better. 40 years into this epidemic, over 40 years, we are demanding better. Some of the things that were included in the National HIV/AIDS strategy talked about that even though we've made some wins, Black women still have, we haven't made wins in terms of Black women's HIV rates going down. We haven't made wins in terms of Black women, mortality rates or comorbidities. That, this National HIV/AIDS strategy, what it did do, it did introduce the idea of racism as a public health issue, although not a lot of details about what to do about it. But finally, it's mentioning that. It's mentioning immigrants. It's mentioning sex workers. We've got more to do, but, we come in all kind of ways, and folks speaking for us are not going to solve our problem. And so the policy agenda is our attempt to finally tell the federal government, you don't know what we want. You don't know how to do it. Here is how. And because of that work that you just saw, some of the language in the National HIV/AIDS strategy around developing a quality of life developmental indicator for people living with HIV is a direct result of that policy agenda, the People's Plan, the demanding better policy agenda. And we're in still constant talks and involvement with moving other agenda items forward around molecular HIV surveillance, around HIV criminalization, around decriminalization of sex work and other aspects. So you can't talk about ending the epidemic without talking about the rest of this. And so I heard them say once, we may end it for some, but not all. I'm not clear what that really means, other than it's not ended if it's not ended for all. Whether
Right.
we talk about stigma, whether we talk about racism, when we talk about structural and systemic reasons why we're still here and why the epidemic won't end until we deal with some of those things. And seeing us as more than our CD4 count is going to
Yeah.
be necessary to do
Well,
that.
it's a lot of barriers, so many barriers, ladies. I appreciate both of you guys and all the work that PWN is doing out there for all women, Black women and trans women, or
But
women.
remember, when Black women get better, everybody gets better. So
Yeah.
let's say this. So even
Mm.
though we're taught Black women, we're taught, but remember, when we rise, all boats rise, right? We can't say we are liberated if we got Black women of trans experience not liberated, right? So
Right.
when we rise, all boats rise, and so it's not an absence of eyesight on others. You can't ignore the disproportionate impact on Black women, and to not talk about it and not to ask why. Data without context is violence, and we show the numbers and we don't tell the why. So the reality is we are the most disproportionately impacted, and everybody says that, but nobody asks why. And then what
Yes.
is the solution? Why aren't we angry? Why aren't we protecting Black women? And or think that this is a problem. But so when Black women get better, everyone gets better. And I'll just stop on that. I want to really call out, I don't call Black women being at risk or high risk. I call it vulnerabilities. These are structural and systemic vulnerabilities that make us more vulnerable to acquisition. Before PWN, I used to say HIV is 100% preventable. And Wahida Shabazz El and others said maybe for some, but not in all communities. And so this idea that is just your behavior is the line and is the story we're all told when we're doing the same thing as in other communities. And why are we so impacted? Is it just
Right.
Black condomless sex, or is there something else going on?
That's
And I'm
what it
telling
was.
you,
I
there's
think it
something
was. It's not. We're not vulnerable because of the area, something like the area we live in. We're vulnerable because of who we have sex with. It was something in that context. Something in that context. I just can't get it out, but it was something in that context, and she clarified it. How many states is PWN in?
Yeah, we have some kind of reach in about 20 states, with seven states that have chapters, 5 states where we have state leads, and then we have another probably like 10 or so states where we have some kind of mobilizable network that has strong infrastructure.
Well, so other women that are watching right now, just explain a little bit what chapters and then lead and state leads are, so they'll know.
So chapters we have 7 of them: Texas, Louisiana, South Carolina, Colorado, New York, Pennsylvania, and Louisiana. And these are states where 5 or more women of folk or trans experience have agreed to work together and become a formally affiliated chapter by just adhering to PWN's mission and values, and have agreed to work together to work on behalf of women living with HIV in that state. So they need 5 or more women that are willing to work together to form a chapter, and then we support them on whatever it is they need to help them develop their leadership, develop their chapter, to formalize, to meet, to help with agenda setting and all kinds of things. We also we've also begun providing funding for chapters to help support like meetings and things like that. So that's formally affiliated chapters.
Now, with the chapters, and it has to be 5 women, do all women have to be living with HIV?
Yes, for those five folks who found it. But let me say this, chapters also, some groups that are formally affiliated chapters also have meetings or have a meeting that's called chapters and allies. They can
Right.
choose how to engage with allies. I know Colorado does a lot of meetings with allies. Some of the work that they may do may involve allies, but there is this focus though, first at the core of it, women living with HIV in leadership. And we try to make sure we build that capacity, because there's a fear sometimes when you have your core folks, if they're not strong in their leadership and you allow others will take over the leadership. So
Right.
they get to choose how and often in the ways that they involve allies in the work, but most chapters do bring allies in for a lot of reasons and partner with others to do the work.
And then state lead.
So,
Explain
and
to them
state
what state
leads
lead.
are individuals that women or folk of trans experience who are living in a state that doesn't have, they don't have those five folks, but yet they want to grow their leadership, and they might be moving in the direction of a chapter. Like Alabama started with a state lead. Katie Willingham was the state lead there and got folks together, and then they became a chapter last year. So a state lead is just an individual person that's also adhering to the mission and values of PWN and are agreeing to want to develop their leadership. And we support them at being at coalition tables of two-way communication between the state, and also helping to organize in that state when they're just an individual that may be connecting them with other coalitions or other kinds of groups in that state. So they're just individuals who may not have the five or more women who want to organize into a chapter.
Thank you, ladies.
Mhm.
Thank you so much for coming on. And I really, I pray that this helps a lot of women who are looking for that structure in policy and where they need to go. Any ladies that are on here watching, you can go to PWN/USA.org, PWN/USA.org, and you can explain how they can go on there and join, and then what happens after that.
Yeah, for sure. So we have, there's definitely ways to plug in. If you're in any of the states Vanita mentioned, you can plug into chapters on the ground there. But also, even if you're not in one of those states, or if you're not in a place where we have regular in-person meetings, there are so many ways to be involved. We have every second Friday of the month, we have a national member work group call. Any person living with HIV who wants to be a member of PWN can join those calls on a monthly basis. We have trainings that are offered, webinars that are offered where you could participate virtually from anywhere. It's totally free. Where we train folks on policy issues, on community organizing, on leadership skills. We coach folks on how to be more impactful in like meetings and things like that too. We know that our women living with HIV, trans folks living with HIV are doing so much in the community. And so we're here to support you and to create like peer support spaces. We also have Facebook groups where you can join and participate. So the first thing is go on to pwn-usa.org and sign up. There's a link that says join or sign up as a member on our mailing list. It'll ask you a few questions. You don't have to share anything you're not comfortable with sharing, but if you just check off some of the boxes there, let us know how to get in touch with you. You will get emails from us, you will get follow-up from us, and you will be invited to participate in these events that are going on, and you'll start to hear about them. We have an e-newsletter that comes out, and then look for us on social media. Check out Positive Women's Network. We're on Instagram, we're on Twitter, we're on Facebook. If you find us on any of those platforms, you will also hear about upcoming stuff that's happening, and things that you can learn about, get involved in, whether it's policy issues, uplifting Black women's leadership in the movement, trainings on gender justice, on reproductive justice. We got a lot going on, and we would love to see you all come through.
And I want to add one other thing. If you are a woman or a person of trans experience living with HIV and you go on to the website and sign up and you admit that you are living with HIV, and we respect all confidentiality, you will then get an email from someone who will reach out to you and connect you to a chapter in your area if there is, make you aware of a bi-monthly support group that we have that's going on, and other ways to be connected. So if you go on that website and sign up and just check that box, it will be kept confidential. We will reach out to you and also welcome you and connect you if you're in a state where there's a chapter, and but also make you aware of other resources if you need a support group, which we started during the pandemic virtually, that still exists and is facilitated by other members, PWN members, and we'll make you aware of other things like that so that you can get connected.
And then one more thing that I would add, because I think you brought up, Dee, the role of like accomplices and allies in the movement and in our work. And, you know, our belief is that for the work that we do, women and trans folks living with HIV, especially those who are most impacted, so especially Black folks, people of color, should be the ones making decisions, driving the agenda. And we have opportunities for everybody to throw down with us. So we welcome allies, we welcome accomplices being part of our work. And we have a lot of things that you can get involved with as well. So anybody who's interested in our work, take a look at it. Take a look at our stuff on social, take a look at our website, sign up for emails. We have so many offerings that are available to anybody who wants to be part of our movement. We do this work in community. We do it with you all. We do it for you all. And we're just excited to keep growing and building this movement. It is together that we win.
I always ask my featured guests, do you have any last words for people out there who are listening? Either one of you, if you do, if you don't, it's okay. Any last words, maybe to inspire or uplift any of the women that are out there watching?
I guess I would say, you know, if you're a woman living with HIV, this doesn't have to be for you. You might want to just connect with community, but you don't know about wanting to do this other stuff. It is okay. We all have a process. It took me a number of years, even though I've been doing community work for years, to process my diagnosis and want to get into this. There is not a rush, a requirement. You can get connected, and there's no shame in moving at your pace. If you know, because we have entry points. Maybe it's just support. We're not a support group, but we are supportive or connecting with other women. It happens in a lot of ways. So I don't want women to feel like if I'm not doing this advocacy, I'm not doing the thing. Living life is work, and processing living with HIV is tough enough. But if you want to be involved, we will provide a lot of ways for you to do that, and or you can just pay attention and learn. But if you want to be involved, we would love to have you. But just recognize, be gentle on yourself, that this isn't a requirement. But if we see you on them virtual or real streets, we will welcome you.
Thank you, Benita. Thank you, Nana. And thank you for being such strong voices for all women, but especially Black women and women of trans experience. You know, thank you so much for the work that you do. I really appreciate it. And I'm sure all the other women out there do too. We're going to close, and you guys have a good one. Thank you for showing up here, because I haven't had you on before, so I appreciate it.
Thank you, Dee. Always so great to see you. Take good care.
Thank you for having us.
Thank you for having us.
So any women who would like to reach out to PWN, you can go to pwn/usa.org. pwn/usa.org. Get a hold of them. Someone will reach out to you. They'll let you know if they have a chapter in your state. And if not, maybe you can become a state lead in your state because you want to do the work. Again, that's pwn/usa.org. Everybody have a great day. And remember, if you're looking for testing, you can go to hiv.gov, hiv.gov. You can type in your city, state, or zip code, and it'll give you all those testing sites in your area. If you want to know more about U equals U, it means a person who lives with HIV, who stays virally suppressed, becomes undetectable. That means a person can no longer transmit HIV to their partner. It's such a liberating message that is actually helping people to want to get back in care. It's helping people with internalized stigma. to feel hopeful now and to feel so much better about themselves. Because we know, a lot of us know how it feels when we're first diagnosed. That internalized stigma eats you up, doesn't it? So go to u=u.org. U=u.org. That's UEQUALSU.org. If you want to know more about HIV criminalization laws in your state, you can go to the Center for HIV Law and Policy.org, Center for HIV Law and Policy.org, and you can look to your left, click where your click criminalization in your area, and you'll pull up the state and click it, and it'll let you know the HIV criminalization laws in your state. Every person who lives with HIV needs to know the criminalization laws in their state. Okay, everybody, this is Positively D discussion. You have to remember that HIV still exists. You have to get tested. You have to use protection. Because if you have contracted HIV, you could get on medication and you could live a better, healthier life. Have a happy day.